For years of routine checkups, you've probably grown used to the same conversation, over and over again. The doctor points at your blood test results and talks about your bad cholesterol. The message has always been clear. Keep that number low if you want to avoid heart attacks and strokes. That advice isn't wrong, but it's only half the truth. Because behind that label of bad cholesterol lies a far more dangerous enemy that most people, and even many doctors, overlook. This is actually the #1 risk factor for stroke in Americans, especially after age 60. The problem is, this culprit is rarely mentioned during regular checkups, quietly progressing until it's too late. Imagine this. You take your medication faithfully, your cholesterol number on paper looks better, and your doctor nods in approval. But then, just a few months later, a sudden stroke strikes. This has happened to millions. Why? Because we've been focusing on the wrong target. We've been chasing after a number while ignoring the real signals that determine the health of our arteries and heart. In fact, science has shown that LDL, the one long branded as the main culprit, is not equally dangerous. There are large, round, fluffy LDL particles that are almost harmless, and there are small, dense LDL particles that can easily slip into the fragile lining of blood vessels, trigger inflammation, and form plaque, the very kind that raises the risk of stroke and heart attack. But here's the paradox. Standard blood tests lump them all together into a single number. That leads to a troubling outcome. We work hard to lower the overall number, which is often less dangerous, while the truly harmful kind slips through unnoticed. No wonder heart attack death rates may have declined, yet the total number of cases keeps climbing. We're getting better at putting out the fire after it starts, but failing to stop it from igniting in the first place. So, what is the #1 risk factor you've been overlooking? Why does focusing only on total cholesterol cause millions of older adults to lose their golden chance to prevent a stroke? And most importantly, what can you do starting today to truly protect your heart and brain? Let's find out in this video. For decades, whenever the topic of heart disease risk came up, nearly all attention has been fixed on a single target, LDL cholesterol, often branded as bad cholesterol. This obsession didn't appear out of nowhere. It began with a famous 20th century study, the Framingham Heart Study, a project that followed generations of participants and was the first to show a connection between high LDL levels and heart risk. That discovery sparked a medical revolution at the time, and from then on, LDL was framed as public enemy #1.
From small clinics to nationwide public health campaigns, the same message was repeated. The lower your LDL, the safer your heart and brain. As a result, tens of millions of older adults have lived in fear of a single number on their blood test. The moment LDL rose above the normal threshold, they were told to cut fat, follow strict diets, and if that wasn't enough, start on statins to bring the number down. Over time, we've been taught to equate LDL with sudden death, and managing health has been reduced to nothing more than a race to chase the numbers. But here's a little-known truth. The Framingham Heart Study itself never concluded that all high LDL levels are equally dangerous. The real risk was seen only at the extremes, when LDL was extremely high, usually above 190 milligrams per deciliter, often due to rare genetic conditions, or when LDL was very low, below 70 milligrams per deciliter, which is uncommon in everyday life. For the vast majority in between, especially people over 60, the link between total LDL and the risk of stroke or heart attack was actually quite weak. Yet the message, the lower the LDL, oversimplified everything. It caused people to overlook other factors just as important, if not more dangerous. The result? Millions of people were prescribed medication, successfully lowered their LDL, and yet still suffered heart events. Our obsession with bad cholesterol has led us to confuse symptoms with cause and numbers with the bigger picture. When a doctor sees a blood test showing LDL above the standard range, the usual response is almost automatic. Prescribe a statin, the most widely used cholesterol-lowering drug in the world. And yes, statins can lower LDL impressively on paper. Patients look at their results, see the number drop, and feel reassured. But then the paradox emerges. Why do heart attacks and strokes keep rising even as statin use becomes more widespread? Many large studies have tried to answer this question, and the results are not easy to accept. The Accelerate trial, one of the biggest clinical studies, showed that a drug highly effective at lowering LDL did not bring any meaningful reduction in deaths from heart disease or strokes. Similarly, in the Jupiter study, even when LDL was driven down very low, risk remained for patients who carried a high number of small, dense LDL particles, the very type most dangerous but least affected by statins. To picture it more clearly, imagine LDL as cars driving on the highway of your bloodstream. They're big, slow-moving trucks, the large, round, fluffy LDL that rarely cause accidents. And then there are the small, fast race cars, the small, dense LDL that slip easily into cracks in artery walls and trigger serious accidents. Statins, unfortunately, act like traffic police who are good at pulling over the big trucks, while the dangerous race cars slip right through. The result is fewer cars overall, but not much reduction in accidents.
This explains the paradox that surprises both patients and doctors. LDL numbers go down, but cardiovascular events don't fall in the same way. The problem isn't the drug itself. It's that we've been aiming at the wrong target. We focused on lowering total LDL, while the real issue lies in LDL quality and the internal environment of the blood vessels. That said, for certain groups such as people with rare genetic conditions leading to extremely high LDL, statins are life-saving, significantly lowering the risk of death. But for the majority, especially adults over 60 with LDL in the moderate range, statins solve only a small piece of the puzzle. This reality raises a critical question. If lowering LDL isn't enough, what is the real risk factor we should be focusing on? And how can we detect it before it's too late? If cholesterol is just the messenger, then the true culprit behind most strokes and heart attacks is insulin resistance. It may sound like a distant medical term, but in fact, it's a condition silently affecting millions of Americans over 60, many of whom don't even know it. To understand insulin resistance, imagine insulin as a key. Its job is to unlock the cell doors, allowing sugar from the blood to enter and be used for energy. In a healthy body, the locks are sensitive. A few keys are enough to open the doors. But over time, when we eat too much sugar, refined carbs, and processed foods, those locks become rusty and stubborn. The body has to produce more and more insulin just to try to force the doors open. This is insulin resistance. The keys no longer fit, and the body is flooded with insulin while the cells are still starved for energy. That's where the trouble begins. When insulin stays high, a series of dangerous reactions unfold. The kidneys hold on to salt and water, raising blood pressure. Blood vessels become inflamed and damaged, making it easier for small, dense LDL to slip in and form plaque. And visceral fat builds up around the liver, belly, and especially around the heart. This fat isn't dead weight. It constantly releases inflammatory chemicals, leaving the heart vulnerable to rhythm problems and weakness. All of these changes compound one another, leaving the heart and brain on the edge of danger. The frightening part is that insulin resistance doesn't cause loud, obvious symptoms at first. It progresses quietly, leaving only subtle clues: a growing waistline, creeping blood pressure, dark patches on the skin, fatigue after carb-heavy meals, or constant hunger even after eating. Most people dismiss these as normal signs of aging. In reality, they are early warnings your body is sending. Research has shown that insulin resistance not only raises the risk of stroke and heart attack, but also lays the groundwork for metabolic syndrome, a cluster that includes type 2 diabetes, obesity, high blood pressure, and abnormal cholesterol. It's like a faucet left running, flooding the room. You can mop the floor as much as you want, meaning take drugs to lower blood pressure or cholesterol, but unless you turn off the faucet, the room will keep filling with water. This is exactly why so many people take their medication faithfully, see their test numbers improve, yet still end up having a stroke. It's because we've been treating the symptoms while ignoring the root cause of insulin resistance. Insulin resistance isn't some completely invisible enemy. It leaves plenty of traces on the body. We just don't pay attention to, or we dismiss them as signs of aging. But if you know what to look for, you can spot 7 early warning signs.
clear messages that your body is slipping out of balance. The first sign is a growing waistline. Many think a beer belly is just about appearance, but in reality, it reflects visceral fat building up around the liver, kidneys, and heart. For men, a waistline over 40 inches, and for women over 35 inches, is a red flag that insulin resistance is already present. The second sign is skin tags and dark patches of skin. You might notice small, soft growths around your neck or armpits, or thickened, velvety dark patches, a condition called acanthosis nigricans. These are messages written on your skin, showing that insulin in your blood is running too high. The third sign is blood pressure creeping up over the years. Your doctor may say, "It's just a little high, let's keep an eye on it." For example, 135/85. But that slight rise isn't random. It reflects insulin signaling your kidneys to hold on to salt and water, steadily raising pressure inside your vessel. The fourth sign is found right in your blood test results. If triglycerides are high and HDL is low, that's almost the fingerprint of insulin resistance. Many people have normal total cholesterol, but still show this lipid pattern, and their heart risk remains high. The fifth sign is difficulty losing weight, especially around the belly. You eat less, exercise more, yet the scale doesn't budge. This isn't a matter of weak willpower, it's because high insulin has locked your body in fat storage mode, preventing you from burning energy. The sixth sign is frequent hunger and irritability when meals are delayed. You may notice shaky hands, restlessness, or even feel hangry, hungry and angry if you skip a meal. This is the classic cycle of insulin resistance. After a carb-heavy meal, blood sugar spikes and then crashes quickly, leaving your body demanding more. The seventh sign is fatigue after eating starchy foods. If you feel heavy and sleepy after a plate of white rice or pasta, that's a sign insulin has surged to handle the massive sugar load, draining your energy as blood sugar plummets. When you put these 7 signs together, a clear picture emerges. If you have 2 or more, take it as a serious alarm bell. This isn't just about your waistline or skin, it's your body warning that insulin is out of control. The good news is, recognizing it early is also your chance to make changes before insulin resistance turns into a stroke or heart attack. When you go for a checkup, most of us are used to seeing the doctor focus on a single number on the blood test, LDL, often called bad cholesterol, and treating it as the only measure of heart risk. But the truth is, that number doesn't give the full picture of your health. Some people with normal LDL still suffer strokes, while others with slightly higher LDL live long lives without major heart problems. So what's the measure you can actually trust? The answer is right there in the same blood test you get every time, but it's often overlooked. The ratio between triglycerides and HDL, also known as the TG/HDL ratio.
Triglycerides are a form of fat circulating in your blood, like drops of extra energy left over from meals. When triglycerides run high, your body is more likely to produce small, dense LDL particles, the most dangerous kind, the ones that can slip into artery walls, trigger inflammation, and form plaque. HDL, on the other hand, acts like a cleanup crew, carrying excess cholesterol out of the arteries for disposal. That's why when triglycerides are high and HDL is low, it's a sign your body is out of balance, and your risk of stroke or heart attack rises sharply no matter what your total LDL number says. Scientists have shown that the TG/HDL ratio is a far more accurate compass than LDL alone, because it reflects insulin resistance, the root of most heart disease. So how do you read it? Simple. Divide your triglyceride number by your HDL. Ideally, triglycerides should be under 100 milligrams per deciliter. If they're over 150, take it as a warning sign. For HDL, higher is better, over 40 milligrams per deciliter for men and over 50 milligrams per deciliter for women. Then comes the key ratio. For white Americans, a TG/HDL ratio over 2.5 signals high risk. For African Americans, the threshold is even lower than 1.5 is already concerning. This is a straightforward, easy-to-understand way to get a far more honest picture of your heart risk than just looking at LDL. Put another way, total LDL is like knowing how many vehicles are on the road, while the TG/HDL ratio
tells you whether those are heavy trucks or small motorbikes and whether they're clogging traffic. So the next time you hold your blood test results, don't just zero in on cholesterol. Look at triglycerides, look at HDL, and calculate the ratio. It only takes a few seconds, but that number may be the most important message about your heart and brain health, showing you exactly where you stand on the risk map and, more importantly, what changes you can start today to prevent stroke and heart attack in the future. After exposing the real culprit, insulin resistance, the most important question is, what can we do to stop it and even reverse its dangerous course? The good news is, you don't need a medical miracle. Everything you need is already within your reach in your meals, your steps, and your daily habits. I call them the 3 golden pillars for defeating insulin resistance: what you eat, when you eat, and how you move.
Pillar 1. What you eat. Think of your body like a fire. Sugar, refined starches, and industrial oils are the gasoline poured onto that fire. Every can of soda, every slice of white bread, every bowl of pasta or refined rice sends insulin skyrocketing. When this happens day after day, your body never gets a break. It's trapped in fat storage mode and constant inflammation. Add to that industrial oils, soybean, corn, canola, sunflower found everywhere in packaged foods, and the imbalance between omega-6 and omega-3 drives inflammation even further. The solution isn't harsh dieting or extreme fasting. It's simply returning to real food. Prioritize high-quality protein, clean meats, fish, eggs, pasture-raised poultry. Use healthy fats, extra virgin olive oil, avocados, nuts, and especially fatty fish like salmon, sardines, and mackerel, rich in omega-3s that calm inflammation and protect the heart. And don't forget low-starch vegetables, leafy greens, broccoli, bell peppers, tomatoes, packed with fiber and antioxidants to cool down inflammation from the inside out. Pillar 2. When you eat. One of the biggest mistakes of modern life is eating all day long. Every snack, every small bite sends insulin up again. Remember, it doesn't matter if you eat a lot or little, every time you eat, your pancreas must release insulin. And when you repeat that from morning till night, insulin never gets the chance to come back down. The solution is to give your body breaks. You don't need to practice harsh fasting. Simply start by finishing dinner earlier, say around 7 p.m., and not eating again until 7 a.m. the next morning. During those 12 hours, your body finally gets the chance to lower insulin and switch modes from storing fat to burning it. Another key step: cut out snacking altogether. Every time you resist that mid-morning pastry craving, you give your body an extra golden window to repair itself. For those over 60, simply shortening your eating window brings real benefits: steadier weight, better blood sugar control, and more consistent energy throughout the day. Pillar 3. How you move. Your muscles act like giant sponges, ready to soak up sugar from the blood and use it for energy without needing much insulin. That means every time you move, you ease the burden on your pancreas and help your body become more insulin sensitive. And the best part is, you don't need a gym membership or complicated workouts.
Start with a 15-minute walk after your main meals. This immediately channels sugar from your food into your muscles instead of letting it float in the blood and trigger an insulin spike. Just one simple habit, but it works like a powerful natural medicine against insulin resistance. In addition, don't overlook light resistance exercises. You don't need heavy weights. Simple movements with small dumbbells, resistance bands, or even just your own body weight, push-ups, sit-to-stands, are enough to maintain and build muscle. Every new muscle fiber is like an extra storage tank for sugar, helping your body respond more efficiently to insulin. For those over 60, keeping muscle also improves balance, prevents falls, and supports independence in daily life. These 3 pillars, when combined, have the power to transform your entire health picture. You're not just lowering a number on a lab report. You're actually resetting your body's operating system. You're extinguishing the fire of insulin resistance at its root, protecting your heart and brain from sudden events, and most importantly, giving yourself the chance to live healthier, more independent, and more fulfilling years at 60, 70, and beyond. Now you can see clearly, the number one risk factor for stroke and heart attack isn't just high blood pressure or bad cholesterol. It's insulin resistance, the silent enemy quietly eroding your body year after year. High blood pressure, atrial fibrillation, abnormal cholesterol, all of these are only alarm bells. If you focus only on silencing the alarms without addressing the real fire, a crisis is bound to happen. The good news is, your body has never given up on you. Even at 60, 70, or 80, if you provide the right conditions, it can still heal. The 3 golden pillars of eating the right foods, knowing when to eat, and moving wisely are the keys to reversing insulin resistance and protecting your heart and brain. They don't require extreme changes, only small, steady steps. Swap a can of soda for a glass of water. Trade industrial oils for olive oil. Add a few minutes of walking after dinner. Go to bed an hour earlier. Each small step is a brick, rebuilding the solid foundation of your health.
The important thing is to take action starting today. Every day you delay is another day your arteries are damaged, another day your heart is forced to struggle. Treat the signals your body gives you with a growing waistline, creeping blood pressure, darkened skin, not as normal signs of aging, but as urgent messages that must be heard. If this video has given you a new perspective, tap the like button so I know the message has truly been helpful. Leave a comment and share your experience. Have you noticed any signs of insulin resistance, or are you already working on changing your habits? Your story could be the very motivation someone else needs. And don't forget to share this video with your friends and loved ones, because they too may be worrying about cholesterol while overlooking the real culprit. Finally, hit subscribe and turn on the notification bell so you won't miss the upcoming videos where we'll continue uncovering the secrets to living healthier, sharper, and more at peace in your later years. Remember, health is not found in a single lab number. Health lives in the choices you make every day, and you can start making those better choices right now.